Joining us today at Real Health are Beverly Johnson and Dr. Linda Bradley. Ms. Johnson is a model, actress, author, entrepreneur who was the first African American model to appear on the cover of Vogue magazine. Dr. Linda Bradley is the chair of the OBGYN section of the National Medical Association. They're here today to speak to us about uterine fibroids. This condition affects almost 75% of African American women, but African American women in particular are 3 times more likely to develop fibroids than Caucasian women. Beverly, Dr. Bradley, a pleasure to have you here.
Likewise. Thank you.
All right, Beverly, I'm going to start with you. Now, before your diagnosis, how much did you know about uterine fibroids?
I was diagnosed with uterine fibroids, in my 30s, and I didn't know anything about it. I can almost remember the day the doctor was, examining me, and he said, "Oh, you have a fibroid." Actually, he said, "You have a tumor." I was like, and it was really a frightening word. And of course, I was interested in, what it was, and he said it's benign, it's very common. I'm saying, well, where does it come from? All those questions that anyone would ask. And so I been watching those fibroids throughout the years and not really taking a proactive path to them. So eventually I had a hysterectomy because of the uterine fibroids about 10 years ago. So that's why I am the national spokesperson for a campaign that we are doing called Ask 4, Tell 4. Ask 4 questions about fibroids and then tell 4 of your friends. And it's a website that's very comprehensive as far as uterine fibroids goes and all those questions that women need to ask and also the answers to them.
Okay. Now, what were some of your symptoms? What did you notice that told you had a problem?
It was a very dark period of my life because I had put off the idea of having a hysterectomy. So when it came to the point where I was bleeding every day, I was so uncomfortable. My whole quality of life was gone. I mean, there was no more playing golf, no more sexual relationships. I couldn't really stray that far away from the home because, I didn't want to have an accident somewhere. And it was very debilitating. And at that point, I did not examine my options, even though I had my best friend there that was saying, "Beverly, there are other things that you can do. You don't have to have a history." I couldn't hear her because by that time, I was so entrenched in my own symptoms and in my own misery. I wanted to do anything to, get me out of this nightmare. So I had the hysterectomy, which a lot of women do. And not saying that that wasn't the best thing for me. We will never know. But I'm saying that there are options. And the uterine fibroid thing that happens to a lot of African American women, only 85% of African American women have fibroids. Sometimes you have symptoms from them, sometimes you don't. Sometimes you develop to have symptoms from them. But I just think that something, there needs to be a conversation about them, and there has to be an awareness about something that 8 times out of 10 you're going to have. So that's why I'm here.
Okay. Now, what did you do right after you were diagnosed with the fibroids?
Nothing. I did with everybody else. I didn't tell anybody. I don't know. I felt like if I told someone, they were going to think I had cancer. And the couple of people I tried to tell, I was, would say, they're benign tumors. Tumors? God, you have to do something. Well, you can't just let that stay there. You have to do something. You have to get that out of you. You turn into, there is so much ignorance about it that I opted just to keep it to myself. And basically, I didn't, it's my own fault. I didn't go out and try to find out what they were or do any kind of investigation on uterine fibroids. I didn't go to any website. I didn't buy any books. Once in a while, I would see an article, and I would like, have and, sneak and peek and read it. But I basically, stuck my head in the sand.